reach by 2030. Fueled by passion, our 550 members working in 175 countries have collectively put in an amazing 50,000 volunteer hours, touching the lives of 2 billion people. And we're driven by values, to which we hold ourselves accountable. 2020 was a busy year, co-creating 3 reports with partners and producing one of our own. Inviting high-level guests to participate in the Catalyzing Change campaign, hosting fireside chats and expert hours, which will be continuing in 2021. To celebrate our achievements, together we placed our supporters in the limelight with the first Catalyst 2030 Awards for Systemic Change. With the blessing of the Dalai Lama, we celebrated finalists and winners in the following categories: special recognition for our early supporters, individual philanthropists, donor organizations, philanthropic intermediaries, corporate organizations, bi- and multilateral organizations, and 4 regional winners in the category of national governments. And now on to Catalyzing Change Week 2021. During this social entrepreneur-led event, we bring together diverse stakeholders in over 100 sessions to showcase their systems change efforts and the best practices that can accelerate our work in pursuit of the SDGs.
A very warm welcome to everyone on this panel with us here today. I want to extend a special welcome to all the people from India, and if there's anyone from Brazil, because these are the
You've become muted.
Well, am I audible now? Sorry for the initial technical glitch. Okay, a very warm welcome to everyone on this panel today. And I mean, in this session today, a special welcome to everyone from India. And if there is anyone from Brazil, because these are the 2 countries that are facing a tremendous COVID-19 crisis right now. And it reflects the tremendous resilience and resolution of the people from these countries to be here with us today. And more strength to you, and thank you for being with us. Now, having said that, I have to clarify why DIKSHA, a youth-focused organization that works to change the ecosystem that denies agency and autonomy to young people, why suddenly this focus on mental health? It's purely on the basis of the lessons learned from our work, especially since the COVID time set in. Psychosocial well-being is a cross-cutting issue. It touches, it affects each of the SDGs. And unless we can bring that to center stage, we will not achieve change. Unfortunately, it is an ill-understood notion in India and in many of the other South Asian nations, maybe in many other countries across the globe. So this is an effort to strengthen advocacy for more focus on mental health care and treatment. With that, I also must share the news that one of our panelists, Mr. Purkayastha, is not here with us today in person because 3 people, 3 close relatives, are facing medical emergencies, so all his strength and resources are there. But he's been kind enough to share his thoughts through a video, which we will share with you today. Welcome to my other panelists, Ms. Aparajita Dhar, Chris Underhill, Sir Chris Underhill actually, because he's been honored with an MBE by Her Highness, the Queen of England, Dr. Shekhar P. Sheshadri from NIMHANS, India, Ms. Vanee Surendranathan from Sri Lanka, and I will say a brief few lines about each of them as they start their speeches. You will have more details about them in the chat box, hopefully. With that, I would like to invite Dr. Shekhar P. Sheshadri first. He's a senior professor in the Department of Child and Adolescent Psychiatry, as also the Dean of Behavioral Sciences Division at NIMHANS, National Institute of Mental Health and Neurosciences, India, a premier institute. Shekhar is much more beyond that because he has been working consistently with a focus on bringing mental health understanding to community levels and creating convergence between government departments and community initiatives. He will be speaking to us about the need to bring psychosocial well-being at center stage. Over to you, Shekhar.
Thank you very much for this very kind invitation. As Paramita pointed out, I guess when we sort of the SDGs.
Welcome and thank you.
The COVID reality had not hit us, and we really need to look at this panel today from the lens of what COVID has done. Very briefly, as far as the SDG is concerned, while one might argue that goals 3, good health and well-being, goal 4, quality education, goal 5, gender equality, goal 10, reduced inequality, goal 16, peace and justice strong institutions, and goal 17, partnerships, address themselves directly to mental health. Let's look at decent work and economic growth, which is goal 8. And if you look at a pandemic like COVID, it has an unequal impact on the most vulnerable populations. And if you look at daily wage workers and migrant workers and what the downside as we come out of this pandemic, whenever that's going to happen, we are already reeling under the raging second wave. It is expected that in October or November, the third wave is going to hit us, and children are going to be affected more because they are unimmunized, and the virus has to find a susceptible host. What is going to happen then to schools? Because if you open school now, those are super spreading events. That what happens to children's educations, and if those ecologies are then constrained, what happens to their mental health? So as Paramita pointed out, we are really in a very complex situation where this pandemic has completely changed our lives and the way that we need to really look at what advocacy means as far as mental health is concerned. I want to very briefly introduce you to Samvad, the board under which I'm sitting now. Samvad is an acronym that stands for Support, Advocacy and Mental Health Interventions for Children in Vulnerable Circumstances and Distress. This is a national initiative and integrated resource for child protection, mental health and psychosocial care, located in the Department of Child and Adolescent Psychiatry where I work. Interestingly, friends, it is supported by the Ministry of Women and Child Development, not by the Ministry of Health, under which we come as an institution. This is because both the ministries see the importance of mental health, which is a ticking time bomb, unless it is addressed immediately. Child protection needs have become all the more important because of the COVID pandemic. For many reasons, the ecology of children's lives, loss of routine, loss of predictability, loss of learning spaces, loss of social interactions, loss of play. How are they going to come out of this interaction, and what's going to happen to mental health and psychosocial well-being there? So Samvad works in 4 verticals: mental health, care and protection, education, and policy and law. It's the first time in the history of a mainstream postgraduate teaching federal government neurosciences and mental health institution that an initiative actually has a vertical on policy and law. And this, as Paramita points out, really stands for what one of the important SGD goals is, which is partnerships to achieve the goal 17 of the SDGs. That the second issue that I want to bring to your notice is that going ahead, what mainstream mental health institutions are doing is basically to take mental health out of tertiary care institutions, out there into the communities. How are we doing this? We are looking at the 112 aspirational districts. India as a country has about 700 districts, of which 112 are aspirational districts, spread across the 28, 30 odd states that we have in this country. And we are going to work with systems of governance, which are called in the districts as the panchayats. And the panchayat has its own system. There are elected representatives, and then there are other representatives who come from the early child care protection systems. The idea is to look at all these service providers and stakeholders, which means the welfare committees, the justice boards, the judiciary, the juvenile police, childcare institutions and their staff, the education system, and look at all mental health issues that affect children and capacitate the service providers and stakeholders in recognizing what are common child mental health issues and provide them with what are called as first level responses. This kind of a decentralized approach will go a long way in not only making child mental health services available to every child who may not be able to reach a tertiary care institution, but it also serves as a second advocacy issue where we destigmatize mental health and we work within local government systems to make the reach for services that much more. It also serves the purpose as we go ahead to look at COVID-specific interventions, particularly as, if you remember the HIV pandemic, we used to refer to what was known as HIV infected and HIV affected. And that's what is happening in COVID. Kids are getting infected, and what does that mean in terms of, but what about kids who are getting affected by one parent or both parents who are infected and hospitalized? We are now having an emerging issue of child losing one or both parents to COVID. And if there is an extended family, how do we work with them? And if there is no extended family, how do state systems respond to actually providing care and support and protection to these children? So there is their mental health, there is their education, and there is dealing with this new agenda of loss, trauma, and grief. And how do service providers actually address issues of grief and trauma where these children are concerned? I'm taking the liberty, my friends, all 70 of you who are on this session today, thank you very much for joining us. I'm taking the liberty to put on chat the kind of work that we are doing for you to have an idea of the issues that we are working with. This material is in public domain because we don't believe in copyright. We believe in a copyleft policy. We want more and more people to take the message of child mental health to communities. Every space that children occupy and inhabit, families, homes, childcare institutions, and with the fact that in Bangalore, where I'm located now, we are in a lockdown till 12th of this month. We don't know whether the lockdown will be extended. So the three primary points that Paramita mentioned: advocacy with the government systems, which we have managed to do through Samvad and made mental health available to all districts. We are operational in 28 districts in this country, and we are expanding now with new programs which are COVID specific. We will also share with you some of the COVID specific programs that we are initiating on 15th of this month, in addition to providing mentorship for all service providers as to how to respond to children. So this is the framework that we have in mind, because if the SGD goals have to be met as we go into the year of operation for the SGD goals from 2020 to 2030, supporting the mental health of children becomes one of the most critical issues. These are some opening thoughts that I wanted to share with you. Paramita, over to you.
Thank you, Shekhar. Thanks a lot. Please, everyone, check for the connections that he's already put on the chat box. And there are already questions for you, Shekhar, but this is to everyone. Please hold your questions. We have a question answer time towards the end of this session, and we will take your questions then. Noting the questions, they will be addressed. Thank you. With that, over to you, Chris Underhill, Sir Chris Underhill. As I said at the beginning, he wears too many hats, too many achievements in his life. He's a senior Ashoka Fellow, an awardee for social entrepreneurship from School Foundation and Shrub Foundation, and the founder of many organizations. I'll share it here. Over to you. Don't want to take more time from you. He will be speaking to us about the need to focus on psychosocial well-being in a global and regional perspective. Thank you, Chris. Over to you.
Thank you very much indeed, and wonderful to be here with you, Paramita, and with colleagues on the panel, and with all 76 participants. The numbers of participants are growing as we speak, which is wonderful. I wanted just to begin with a few remarks around the global situation. As you know, in mental health conditions can have a very substantial effect on many areas of life, and Shekhar has already referred to school, but also there is, of course, the whole question of work performance, relationships within families, and of course friends, and ability to participate in the community, all of which is important. It's amazing to think that two of the most common mental health conditions, that is to say depression and anxiety disorder, cost the global economy something in the order of $1 trillion per year. So this is a very serious set of conditions which we are dealing with, and which of course have been exacerbated by the COVID scenario. I think it's true to say that mental health conditions are generally increasing in the world. The latest data that I have been able to get hold of suggests that it's about 13% rise in mental health conditions, which now cause something in the region of 1 in 5 years lived with disability. And around 20% of the world's children and adolescents have a mental health condition, which Shekhar will refer to later. And suicide, unfortunately, is the second leading cause of death among 15 to 29-year-olds. So when you look at this, that's already quite a substantial problem. But when you also look at the funding of this, in other words, the funding of the support from state and philanthropy in regard to mental health conditions, it is something globally of under less than 2% health expenditure is funded on chronic underfunding of mental health. In other words, there is a huge disparity between the gross figures of those people who are unwell and need support and the degree to which the funding is being provided. I think we need to understand, and I would like to take forward the leadership provided by Shekhar in regard to the COVID itself. We mustn't forget that bereavement, isolation, loss of income, and fear are all triggering mental health conditions at this time in adults, as much as he has mentioned children. And many people face increased levels of alcohol and drug use, insomnia and anxiety, all of which comes within the mental health. I'd like to look at the region now very briefly, and incidentally, I am putting together a fact sheet which I would be happy to share through the Catalyst organizers. Mariana is here today with us, and so I'm happy to put together a fact sheet which anybody who would like to receive one may receive, particularly with regard to the information globally that I have already given you, and and some of the facts and figures from the region. I'm most indebted to a number of individuals who have been providing me with up-to-date information. So, for example, in the context of India, the global population something in the region of 1.4 billion. And at any one time, surveys seem to indicate that about 150 million Indians are in need of active interventions. This is as a survey taken in 2016. And by the end of 2020, something in the region of 56 million Indians suffered from depression, and another 38 million suffer from anxiety disorders. Now that is very significant, and when you think about it, India, of course, is a huge country, something like 693 NGOs in operation in India, but that is also in the context of all disability groups, not simply mental health. That information comes from the National Trust. Pakistan, something in the region of 221 million people in the population generally, pretty much. So there are some important community-based initiatives, and community-based work has been already emphasized by Shekhar. I think it's important to note that there is still quite a reliance on hospitals, something like 5 mental hospitals there, and between 400 to 500 psychiatrists, and again, same in the context of psychologists. Funding there is about 1% of the budget. Bangladesh, total population 164 million. And here you have an overall prevalence, as estimated, of some 20 million people suffering at any one time from mental illness. Among the adults, about 16.8% of total population, and younger people, 13.6%. There are 2 major inpatient facilities in Bangladesh, and I have been to both of them as it happens. One is in Dhaka, with about a 200 bed capacity, and one is Pabna, which is way out from the center. That's a 500 bed unit. There are a number of significant NGOs working in Bangladesh. Ad International is one of them, and as colleagues will know, I am the founder of Ad International, as well as Basic Needs, which other colleagues have been working on. Sri Lanka has a smaller overall population, 21 million, and at any one time, total number of mentally ill persons, about 58,000. There are a number of institutions in Sri Lanka, but there has been a major effort to move away from the institutionalized care and to move into community-based activity. Now, I have more information that I'm very happy to share, and I'm very grateful to individuals who have been giving up their time in preparation for this seminar to share fact sheets, and I'll be able to give those out, as I have said already. I think really important in all of this are some of the challenges to us both regionally, but also in the global context. The financing of global mental health is clearly a huge, huge problem. And it's noticeable that there is now a major campaign to try to bring the financing of mental health globally into the global fund. That is to say, the fund that originally set out to fund HIV and AIDS and now funds malaria and so on, tuberculosis. And there's a major move to try and influence that, the new policy of that fund, to try to incorporate mental health in it. When we come to towards the end of the session and we talk about other challenges, I will also bring those. But I think for the time being, Paramita, that's me for now. Thank you.
Thank you, Chris. Thanks a lot. There are people here who want to connect with you, Chris. So if you could please type your email ID if you're okay with that.
Yeah, I'll do it.
With that, I will go to Vanee, who will be sharing with us the mental health scenario in Sri Lanka. She works with CBM, an international organization of repute working with people with disabilities, and has many years of experience of working in the sector. Over to you, Vanee.
Thank you, Paramita ji. Thank you, Chris, for giving us a small introduction about Sri Lanka. What I'm hoping to do is talk about Sri Lanka actually with the implementation background that I have been doing, what's happening at the ground level, and what are the challenges that we are facing as a country. So if I'm to look at, I mean, why we have mental health issues or what is happening as a background to the country, if you look at it, most of you all know that we have gone through a 30 years of war, which has disappearances, death, lot of property, displacement, broken families. We have faced quite a lot of challenges during this war. Even the war ended, we have not come to a proper reconciliation measures that has taken for us to start healing process to begin. And Sri Lanka, of course, has one of the highest domestic violence recorded in the Asia region, child abuse, and school violence. As Dr. Shekhar, we also been implementing a lot of projects with children and adolescents. So some of the survey that we have done with the children speak saying that most of the negative mental health effects that comes from what's happening to them at the school, the violence that they have to face in the school, bullying, favoritism, corporal punishment that they have to, or shaming that has majority of the mental health that's negatively affect them, and alcohol and substance abuse. In addition, we also have a largest aging populations, and we have faced with a lot of mental health problems with our aging population. And the Easter Sunday attacks that happened in Sri Lanka. And now we are faced with a COVID-19 and the pandemic issues that is affecting all our day-to-day life. And it's also widening the resource gap that we used to have it. The disparities are actually widening. For example, if I'm to say, I mean, like few months ago, a child in one of our project locations who's 14 years old committed suicide. So why, if you are looking to the suicide, the lack of resources. So this disparity is going to go more widening. The child couldn't attend the Zoom classes because the child lacked resources to attend the classes. So this is something. So the child is only 14 years old. So the disparity is also going to widen the situation that we are already facing. As Chris mentioned earlier, there are the common mental health issues like depression and anxiety, which is affecting the global economy. The issues that I mentioned earlier now, what Sri Lanka is faced with, not with severe mental health issues, but the anxiety affecting it, this comes with this background, domestic violence, school violence, which goes undetected and are not treated at the right time. And there is also no ground level mechanisms for us to do early identification. Having said that, Sri Lanka actually has put a very good, we have a very favorable policy environment. We have introduced the mental health policy, which is recently approved by the cabinet and which is applicable for the time period of 2020 to 2030. And we also have put in place infrastructure, physical infrastructures like acute inpatient ward, which are decentralized in district hospitals, immediate care rehabilitation units, and also one National Institute of Mental Health, which cater to 1,500 in-house patients. We also have a considerable amount of human resources, around 105 psychiatrists in the country, trained medical officers, and also diploma qualified. So having this, I mean, the government that has put in place considerable amount of resources for institution and also human resources, but we are still faced with major issues with mental health problems in the country. As you all, some of you all may know, we are one of the countries that has always placed in the top for number of people committing suicide every year. Sri Lanka is always within the 5 top countries. So this is a continued thing. I think in 1996, we were the top country on the world, and the measures were brought in to reduce this thing. But why are we having these issues and it still continue to be? If you look at the statistics, actually we have a problem. It's all mostly disease oriented. The approaches are delivered by medical doctors and it's all disease oriented. It's treating only the acute illnesses, but not about the person who's suffering from the illnesses and their background. And we also lack prevention measures. and inclusion measure, community mobilization and reintegration with the community. We used to have large NGOs doing this part, but unfortunately they have left the countries and we don't have that gap being filled by any other person. And also lack of mental health literacy. It's also among the individuals who are affected, the caregivers and the employers and the community at large, which is also causing the larger part of the this stigma, discrimination and exclusion. And touching on just about the media, I mean, as one of the structured, our discussion today, we don't have a very structured approach with media, but few houses are promoting health and well-being. And however, majority are, the stories are very sensationalized and charity way of telling stories, not bringing the facts into the scene. So this is a small synopsis of what is happening in Sri Lanka. Thank you. I think I have taken my time.
Thank you very much, Vanee, for sharing the situation in Sri Lanka. With that, I will request Mariana, our technical support from the Catalyst 2030 team today, to please share Deep's video with everyone because he brings in a very special perspective. Thank you.
Thank you, Paramita Banerjee, for inviting me to this workshop organized by Catalyst 2030. It's a pleasure to be in this workshop. I am Purkayastha from Praajak. Praajak works mainly with young people and adolescents around issues of gender-based violence and gender equity. Today I'm here because I really want to talk about how mental health interventions or the mental health professionals as such really need to focus on men and boys. We have all heard about toxic masculinities and the effect it has on women and on men themselves. And we know that toxic masculinity is something which needs a mental health approach. It cannot just take a very socio-legal approach for solution. The second thing is about the absolutely almost denied in the community levels, invisibilized issue of sexual violence against boys. And I would like to really highlight that because I'm not sure if our mental health interventions, our mental health services are actually equipped to deal with this silence, are actually equipped to know that if there is a boy who has faced sexual violence and who comes for our help to us, whether we are actually equipped well enough to actually help that boy. So these are the two issues I want to highlight. The other issue I want to highlight is about how we can actually take mental health services and mental health support to the community level, how to build resources in the communities. So far, what has happened is that we have tried to build maybe, community social workers or, barefoot, I don't like to use the word, but barefoot counselors, etc. in the communities to actually deal with some of the issues there, which is fine. We need to really, look at how we can expand services into the communities. But if the community really has to own this, if the community really has to look at mental health in a way that is not stigmatizing, then I think we really need to look at and assess community practices of well-being. How, in what social and cultural ways do communities actually keep well? How do they deal with their, mental problems? And maybe we can learn something from that. Maybe we can actually align our programs to that and actually strengthen already existing community institutions. Maybe we need to tweak things a little bit, but maybe use the already existing energies within the community to take care of itself and use those energies to actually focus on better mental health services. I really apologize to all of you that I am not able to be present to you in person. But I'm really thankful to the organizers for at least allowing me to have my say over video. Thank you so much.
Even though Deep is not here, I would still like to thank him for taking time out to make this video and share with me, because I know how difficult a situation he is in. Two very important points he made. One is the need to look at community practices. How do communities stay well? What are their usual mechanisms of building and sustaining resilience? I really think that's an important area. And the second is the need to focus specifically in boys, particularly from the angle of sexual violence, because it's a very, very neglected, almost shut out area, shut out factor. With that, I welcome Ms. Aparajita Dhar. She is a trustee and a friend of DIKSHA, but she has 2 decades of experience working in the development sector in national and international agencies, mostly in donor agencies, which is why she will share the donor perspective with reference to mental health initiatives with us today. Over to you, Aparajita.
Thank you so much, Paramita. This is an honor to be here talking with my alongside my other colleagues. I just want to focus on a couple of things, particularly in terms of the funding aspect that we have related to mental health. So, you know, as we were all listening to Dr. Shekhar, Chris, then Vanee, and also Deep, we just understand that the problem is there and the problem is huge. And as we hear also them mentioning about the post-COVID world that we are all into, which is equally debilitating impact having on all of us, actually increasing our levels of stress, anxiety, and depression. And I'm talking about every one of us, the young people, the children, adults. And as Dr. Shekhar rightly mentioned, people affected and infected both, you know. So we need to understand that psychosocial need is an intersectional and intersectoral issue. And if it is not addressed adequately, then it can have a severe tangible consequences and socioeconomic repercussions. Because well-being is prime for any human being to attain their full potential. But sadly, the psychosocial support and treatment in South Asia, and particularly in India, is severely underfunded and underserved. So if you just look at some of the few, stats, I was also checking some articles, and I found that the proportional contribution of mental disorder to total disease burden in India has doubled since 1990, but it is not accompanied by a parallel rise in the budget allocation. Now, in India, we have this Mental Health Care Act, which was passed in 2017. It's very well designed to support protection, promotion, and fulfillment of the rights of persons with mental illness, and puts onus on the government to provide affordable mental health care to citizens. And it should roughly estimate to about 94,000 crores annually. It is in INR terms. But if you see, the National Mental Health Program in India is more or less funded to around 50 crores only, and that also sees a reduced allocation with each passing year, which is quite a worrying trend, creating huge gap in trained professionals, facilities, and awareness generation. We actually need...
Aparajita, please, I mean, allow me to come in. Your video is off. We would like to see you as you speak, please. Thank you.
My video is actually on, but okay, I'm just trying. Sorry for this technical snag. Maybe I'll just try, but I'll continue talking because otherwise I'll eat up the time. So both government and public sector investment needs to be pumped in for increased mental health care and treatment. And we need more and more donors committed to promote psychosocial support. But you know, the entire silence that we have, which Deep was also mentioning, about this entire issue and the huge stigma associated with the issue. So that's why we are constantly focusing on this three-pronged advocacy approach today, particularly in this discussion that the media needs to play a significant role in building public opinion on the importance of psychosocial well-being. We also need to engage at the community level to eradicate stigma and raise awareness of the issue. Now, mostly us donors, and I know many of my colleagues have joined us today, they will all know that, we are always behind quantifying impact. We want to see the impact, and that's where we want to, bring in our investment. But quantifying impact is very difficult in psychosocial well-being. It's very invisible. It's not tangible. So maybe there is a need that we call for a standard well-being framework which can be used to measure impact. And instead of, doing standalone programs, can we consider psychosocial well-being as a cross-cutting issue, very much like gender within the rights-based approach and systemic change framework? So that will be some of my, thoughts that I would like to say. So thank you, Paramita, for this. And I can add if there is any other comments or questions for me.
Thanks a lot, Aparajita. I would just like to share with you my daughter. My youngest daughter is sitting next to me. She hasn't registered, but she's very much here. And she just pointed out something which I think is important to share here. It's a news in Business Standard end of 2020 that Supreme Court has, just a second. Supreme Court has issued a notice to the government to ensure that insurance cover extends to mental health. I think that's good news if we actually take it up seriously. Shekhar, this is, maybe you are aware, but still this is for you and all the other activists here with us.
Fantastic.
Yeah, so with that, I think it's time for our breakout session, which is the virtual version of group exercises that we do when we are physically doing a workshop. So Mariana, just put us in different rooms. I'll tell you that we've 20 minutes, right? 20 minutes to be in the